Hi, my name is Noor. I'm going to be your nurse today. Can I have your name and date of birth, please?
Lucas Gonzalez, 9/30/97.
Hi, Mr. Gonzalez. I'm going to be conducting an assessment on you today. I'm going to inspect your head, eyes, ears, nose, mouth, and throat, as well as chest today. Do you have any concerns before we begin?
No.
Okay, awesome. At any point during this assessment, feel free to stop me if you have any pain or questions, okay?
Okay.
Okay, awesome. So overall, general appearance, he looks no abnormal findings. His skin color is normal for ethnicity. No sweating, bruising, bleeding. His skin is intact. And so I'm going to begin with the head. So inspecting his head, I don't see any abnormalities. No bruising, no bleeding. His hair looks full and healthy. So next I'm going to inspect. So I'm inspecting his hair, his scalp. I'm going to feel his head. It feels symmetrical. Do you have any pain when I'm touching any parts of your head?
No.
Awesome. And I don't feel any masses or anything like that. Okay. So next is his face. His face is symmetrical. I'm going to start with his eyes. Can you please raise your eyebrows for me? Now close your eyes really hard and open them. Awesome. So those were some cranial nerves. Next, I'm going to take my pen light. I'm going to start by testing your vision. So I'm just going to hold this in front of you, and then I'm going to pull off to your side. Tell me when you can no longer see them in your field of vision, okay?
Okay.
You can still see it?
Mm-hmm.
Right now.
Yeah. No.
Okay, awesome. And now the other side.
No.
Awesome, beautiful. Next, just look in front of you. Now, can you cover one eye? I'm looking to see if his eyes drift, if there's any astigmatism, but there's nothing like that. And now cover the other eye for me, please. Awesome, same for that one. So next I'm gonna test for pupil accommodation. So I'm gonna turn on my light. Can you just look forward for me, please? Awesome, and his pupils do constrict to the light. Next I'm going to test for 6 points of view, vision points. So all I need you to do is focus on my pen light and follow it with your eyes and not your head, okay?
Mm-hmm.
Awesome. Any pain or discomfort doing that?
No.
Okay. Next I'm going to inspect his conjunctiva. Nice and pink. His eyelids don't appear to be swollen or any draining like that. His sclera is nice and white. And now we're going to be moving on to the nose. For your nose, have you been experiencing any loss of smell, any drainage, any difficulty breathing?
No. Everything's fine.
Awesome. So next I'm going to palpate for your sinuses. Any pain?
No.
Okay. Now I'm going to inspect with my pen light. I'm just going to look into his nose and see if there's any drainage and look at the color of his mucosa as well. Mucosa is nice and pink and I don't see any drainage. I'm just going to go back and assess your temporal arteries. So I'm going to be touching your face, okay?
Okay.
So I'm palpating his temporal arteries and I'm feeling +2 on each side. And then while I'm here, I'm going to go down to his jaw and ask if you can please open and close your mouth. Awesome. No popping or clicking. Now I'm going to go to the ears. Visual inspection, I don't see any abnormal findings, no drainage, no redness, no bleeding, no masses. Next, I'm going to palpate. I don't feel any masses. Any pain?
No.
Okay. And I'm also going to look in. His eardrums look pearly gray. And I don't see any drainage. Okay. Next, I'm going to go to the mouth. His mouth looks symmetrical. I don't see any facial drooping, any involuntary drooling. And now I'm going to ask if you can open your mouth. Okay, I'm looking at his oral mucosa. I'm looking at the tongue. I don't see any lesions or sores. Can you open your tongue and then say ah? And see the uvula moving up and down. And can you swallow for me, please? Awesome. Any pain or discomfort? Awesome. So next I'm going to be moving down to the neck. Visual inspection, everything looks symmetrical. His trachea doesn't look deviated to one side. And I also don't see any jugular vein distension. So next, I'm going to palpate. I'm feeling for the carotid artery, one side at a time, +2. Now I'm feeling for the thyroid. I don't feel any enlargements, and I don't feel any abnormal lymph nodes as well. Any pain? Awesome. Now I'm going to inspect your chest. Okay? So first, visually inspecting, I don't see any difficulty breathing, any labored breathing. I don't hear any difficulty as well. Next, I'm going to palpate. I don't feel any thrill. On the back as well. So my next portion, I'm going to listen. I'm going to listen to your lung sounds, and with every point, I'm going to ask for you to take a deep breath, okay? If that becomes too difficult, just let me know, okay? Take a deep breath. Again. Again. Awesome. Now I'm going to do the same on the back, and I'm going to do that same ladder motion. Take a deep breath. One more time. Again. 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 Great. I don't hear any adventitious breath sounds. Your lung sounds very nice and clear. So next I'm going to assess your cardiovascular system. So your cardiovascular system pretty much has to do with your heart and your pulses. So I'm going to just assess your pulses from your head to your toe. Visually inspecting, I don't see any discoloration or anything like that in your skin, so everything looks good so far. I did the temporal arteries, the carotid, brachial, +2 on both sides, radial, +2, femoral, +2, popliteal, dorsalis pedis, dorsalis tibial, and then pedis. Awesome. Next I'm going to listen to your heart, okay? So then I will be locating the apical point, which is on the left lower side of the breast. So right underneath the nipple line. I hear a nice strong pulse, and I'll count for a full minute. And I got 80 beats per minute. Oh, sorry. Okay. That concludes my portion of the assessment. Do you have any questions, comments, or concerns for me? anything changes, feel free to